Great. Thank you so much, Teresa. I was really reflecting as you were talking about that, particularly your comments about your role in developing relationships with the leadership throughout the institution, and thinking that, again, we talked last time about a lot of those people have influence with our donors and with our grateful patient donors. So all of these pieces do knit together. And we're going to talk, as Teresa mentioned, next about gratitude and the grateful patient fundraising framework. And again, we really appreciated all of your comments on the slide, the questions in the chat that we did last time. So you can go back. We've got a question coming up on the next slide, and you can go back to that questions tab. And we have a quick question for you, and that is, when you think about the term Grateful Patient Program in your organization, what does that mean? One of the things that I've observed over the years is that different organizations use that term sometimes a little bit differently, and that's okay. There are no right or wrong answers. That's what it means to your organization. But what does it mean? If you have a moment to think about what does that mean in your organization, maybe share that with us in the questions tab. So interesting to see what you might say. Giving to the organization after receiving care, ways to help people do that. One I can see here. Interesting thoughts. So on the next slide, again, it's no right or wrong answers, but we'll talk a little bit more about what that Grateful Patient Program is. So on the next slide, just a couple of points before we dive in. That the Grateful Patient Framework really is built around gratitude. We talked about that in the first section. It's grounded in a culture of giving, but perhaps most importantly, it's grounded in a respect for the caregiver-patient relationship. As we start working with clinicians, with physicians, with nurses, and with other caregivers, one of the keys to our success is that we approach it with the starting point is a respect for their relationship with their patients. But perhaps one of the most important points in this section is that the key to a Grateful Patient Program is to match the approaches in your organization with your organizational resources for best results. A Grateful Patient Program in an academic medical center might look a little bit different from one in a community hospital, or a community hospital is the only hospital in that community, or a hospital that is in an urban area where there are many healthcare assets. So one of the keys to success, again, is understanding all of the elements and choosing what's right for your organization, for your resources, for the best results. So to help you make those choices, or to understand the choices that those you are working with in your organization are making, we have the next slide, which in a picture represents really the four core elements of a Grateful Patient Framework. In the upper left-hand quadrant of our visual, we have annual gifts, new and renewed donors, goes around going clockwise to major gifts, continuing clockwise to healthcare allies, and then ending with donor service and engagement. So the Grateful Patient Framework represented in this graphic, what we will do is we'll go from that upper left-hand quadrant around clockwise and talk about each one. So in the upper left-hand quadrant is annual gifts, and our annual giving programs are, of course, designed to build our base of donors, to bring as many people into funding the mission. And we do that by bringing in new donors and renewing donors and engaging donors in building those relationships through annual giving over time. And in the Grateful Patient part of our annual giving program, there are really two ways that Grateful Patient Framework works in annual giving. The first is through Honor a Caregiver program. You might have heard the term Guardian Angel program that is used quite a bit. And with all of these, there is a continuum of what you can choose. Some organizations offer the opportunity for people to make gifts back to honor a particular nurse or a physician or another caregiver in the organization. And they, because they just have the resources to do some basic promotion, that's what they do and give donors the opportunity to do that as a way of making their first gift. Some organizations incorporate the ask for an honor caregiver gift through their mail program, through their direct mail program. And then others at the other end of the continuum might have a full guardian angel or honor a caregiver program where they promote gifts in honor of a caregiver. They might list them in an annual report. They go to the caregiver at their place of work to present them with something as a part of honoring them for the gift. Some then have thank you notes that the caregiver sends back to the donor to complete the circle. But somewhere on that continuum, this honor a caregiver strategy is a part, generally speaking, of the annual gift portion of a Grateful Patient program. The other is an active program of reaching out to patients through a mail program to ask for first gifts. And again, there's a continuum. Some people do it a couple times a year, sometimes quarterly. Some do it where they do screening before to refine the list and target the list to whom they think are going to be the best prospects. Again, it depends on what your resources are for exactly how you do it. The most important thing is how you tie all of this together, or what you do around through stewardship, through contact, through outreach, these opportunities for people to give their first gift. So for example, in an organization where I was a chief development officer, there was a patient who made her first gift to a Grateful Patient mailing, and she did make it in honor of a physician. We knew from our research, our prospect research work, that although she'd never given to us before, we knew that she had the potential for making a large gift. So we made a thank you call to every new donor, and that particular call was assigned to me to make. And I called her on the phone, and I said, Zuza, just thank you so much for your gift. We're just so happy to welcome you into our family of donors. And I always like hearing, why do people give? Could you tell me a little bit more about why you gave? And we had a lovely conversation, but the bottom line of the conversation was, for Dr. Hinkle, I would do anything for Dr. Hinkle. So I ended the call by saying, thank you so much for sharing that with me. I run into Dr. Hinkle quite frequently. Would you mind if I passed on to him that you're honoring him? And she said, of course, that would be fine. And that conversation really began a long-term relationship of giving into major gifts. So it's an example of what to do around your annual giving program to make it as effective as possible. She did become a major donor, so we'll move to the second quadrant there on the upper right-hand side of how the Grateful Patient framework works with major gifts and cultivation and solicitation. And again, there's a continuum of options. There are some organizations that will look into their donor database and see who maybe has given several times, has some loyalty, perhaps is screened for being a major gift prospect. And then perhaps they've had a recent experience in your organization. So you look at their giving history, you see that they've had a recent experience, and determine a way to reach out to them and see if the time is right for them to step up their giving to make a larger gift in gratitude for that recent healthcare experience they had. Some organizations take it one step further on the continuum and see where the intersection of that Grateful Patient experience was with a physician, and perhaps involve the physician in developing that relationship. And we're going to talk a little bit more about what that looks like in just a minute. But so again, just that continuum. But at the very basic, generally speaking, not 100%, but generally speaking, most of the donors that are in our major gift portfolios have had some kind of experience. So at the very least, what we want to do is remember that framework of gratitude, that wherever we are in our relationship with them, it is that framework of gratitude and giving back to an organization that's important to them. So if we look down at the Healthcare Allies engagement, the third part of our model here, Again, we are coming from a framework of gratitude and with respect for the relationship of our healthcare allies with their patients. So in that major gift model that I was talking about, where the physicians are engaged or the clinicians are engaged, it really is it's not a transactional expectation that we're expecting them to ask for the gift or that they are required to work with us to help develop gifts. But what I have found over years of doing this is that there are a number of physicians and caregivers who want to help. They want to help the organization. Perhaps there's a specific area of fundraising they want to help with. And our first step, our job, is to get to know them, to get to know those who do want to be involved, not to be shy about asking if they want to be involved, but asking in the right way, and then finding the way they do want to be involved. Some will be comfortable making an introduction. Some will be comfortable if we reference them, if we make a call to the donors. Some will be willing to meet with us on a regular basis, and it's always fun to determine the right place for each person as to what time of day and place that they'd be willing to meet with us to talk about individuals, either from a recent experience or, best case scenario, someone who's given to us for quite some time, who's had a recent experience, who might be ready to make a major gift. But it's all, again, founded in that respect for their role in patient care and developing relationships with them to find out the best ways for them to be involved. So, for example, the story that I was telling about Zuza, I did talk with Dr. Hinkle, and it just happened he was a cardiologist, and we had an initiative for raising funds to expand a cardiac cath lab. So Dr. Hinkle agreed to be a part of a tour that we gave to Zuza to show her, demonstrate, talk about why we needed to expand the cardiac cath lab. He was very gracious. She loved having the chance to talk with him. But he did not ask for the gift. I asked for the gift later. But I am sure that at the very least, the size of that gift was influenced by the fact that he was involved in articulating the case, really, and articulating why our major gift initiative was so important. In terms of other clinicians, nurses, for example, once again, there is a continuum of how we can involve them in our fundraising. The story that I told last time about a nurse who called me because a patient had asked to speak to someone about making a gift. That experience happened because we were on the very highly developed end of engaging clinicians and caregivers in the Grateful Patient program. So that when he said to her, I would like to make a gift to say thank you, is there someone I can speak with about doing that? Rather than saying, it's our privilege to serve, thank you, don't worry about it, she said, I know exactly who to call. She called me and I was able to go over to connect with him and visit with him about his gift. So another good example of how our healthcare allies can work with us. So the last block is donor services and engagement. And a lot of this is our typical stewardship that we provide. You may have heard the term concierge. That relates to this block as well. And it's not about giving extra care or a higher level of care, or it really is about recognition and acknowledgement of the special relationship a donor may have with us through their giving. So an example, there's some major donors who have grateful patients in their portfolio, and they may be the concierge. Some organizations have a staff member assigned to do that patient donor services piece. There are many different ways to do it. A very quick example with a different patient in another organization where I was working, we had a very major donor who was in my major gift portfolio. It was a Saturday night. Her son broke his arm, and she took him to the ED at our hospital, and she called me on the way. And so I met her there, and I helped her understand on a busy Saturday night in an ED why maybe her son might have a little bit longer wait. But I sat with her, I talked with her, I helped her manage that part of the situation. I brought her a cup of coffee. I had a box of toys in my office, and I brought a toy for her son. And while she didn't get access to health care any different from anyone else who came in the ED, what she had access to me what she had access to in that experience was me, and I helped make that experience more pleasant for her and for her family. So that's an example, and it was also a part of our long-term relationship, giving relationship with the organization. So an example of how the patient-donor services fits in. At the beginning, I asked you to reflect on what Grateful Patient means in your organization, and so I asked you to think about that again. If you're in an organization where Grateful Patient means your mail program, you might look and see how can we augment that. If your organization uses the term Grateful Patient to mean the clinical relationship with clinicians, then you might again look and see where else can we augment. And the bottom line, most important thing, is to choose the elements of the Grateful Patient program based on your organization, your situation, your resources, and perhaps choose those areas where you know you're going to get the biggest return for the investment of time. So we have 3 more slides. One is describing in words the patients overall, one about physicians, and one about nurses. And these 3 slides really just put into words for you to have as a resource the things that I've been talking about. The final 2 slides that I want to call your attention to before we move on. One is about Hipaa. And the good news for both the United States and Canada is that our privacy laws, it's slightly different between the United States and Canada, but our privacy laws do allow us the opportunity to access what we need to build a Grateful Patient program that's right for our organization. AHP has some very helpful resources. I did post some slides on the huddle that kind of boils down the most important aspects, so you might want to reference those if you haven't. And AHP was very gracious and downloaded or posted on the huddle for this class 2 of the published resources that are shown on the next slide, Hipaa, Fundraising Under Hipaa, and then Ethical Issues and Recommendations, 2 terrific sources, and I hope that you'll take a look at those. So on the next slide, I'd like to leave you again with a little bit of inspiration for your Grateful Patient program. First, this book, A Little Book of Gratitude, is just a terrific little book, makes a nice gift for board members or for those who help you throughout the organization with your Grateful Patient program. And in this book, the author says, gratitude is not just a nice sentiment, a warm, fuzzy feeling, or a strategy for being happier. It is the truest approach to life. We did not get where we are in life by ourselves, so living in gratitude is living in truth. And when we design a Grateful Patient program that allows our patients to express their gratitude and provide even more resources for our clinicians, our caregivers, our healthcare allies to do their best work, we're helping our organizations, our mission, while once again helping patients.